I'm Rick Kaler. Thanks for joining me. Well, if you have health insurance through the Affordable Care Act marketplace, known as the exchange, you're likely to see dramatic increases in your costs next year. And this is due to a combination of factors that a July 18th, 2025 article from CBS News calls a one-two punch of double-digit premium increases, along with a sharp drop in the federal subsidies that most consumers depend on to buy coverage. Insurance companies participating in the marketplace are requesting the largest premium increases in more than 5 years. At the same time, temporary enhanced federal subsidies, which were first expanded in response to the pandemic, expire at the end of 2025. During the pandemic, emergency provisions extended eligibility up the income scale and streamlined the process for calculating subsidy amounts. The One Big Beautiful Bill terminates these supports. It limits who qualifies and reintroduces documentation requirements and eligibility verifications, steps that are likely to reduce enrollment. Unless Congress intervenes to extend the enhanced subsidies, out-of-pocket costs for consumers are going to revert to pre-pandemic levels. The Kaiser Family Foundation projects that ACA enrollees will see premium payments rise by over 75% on average in 2026 if the enhanced subsidies are not renewed. The temporary credits reduced annual premiums by an average of $705, and that's per month, and helped increase marketplace enrollment from 11 million in 2020 to more than 21 million in 2024. The expiration of these tax credits eliminates the price cap that previously limited the ACA benchmark premiums to 8.5% of household income. Many families who receive subsidies will face double-digit premium increases or just lose coverage entirely. An article by Elizabeth Buchwald in MarketWatch cites the Congressional Budget Office, the CBO, projections of a 93% average premium increase for subsidized enrollees and a projected 4.2 million increase in the number of uninsured Americans by 2034. The greatest impact would likely fall on young adults, older enrollees, and those living in rural areas. Lawmakers and administration officials have described these moves as eliminating waste, fraud, and abuse. Independent policy analysts, however, don't support the assertion that the scale of these subsidies cuts is explained by simply rooting out fraud. If you expect these changes to affect your health insurance costs, here's some suggestions you might consider. First, don't wait until the November 1st open enrollment period begins, or until you get a premium notice to do something. Log in now for your state or federal ACA exchange account and review the projected premium estimates for both 2025 and 2026 so you can calculate your new estimated monthly cost. Then, if you're likely to see a significant increase, begin now to consider your options. Here's a list that might give you a place to start. Can you tighten your budget and scale back non-essential spending to build a reserve fund to help cover next year's premiums? 2, given the job market in your community and your particular qualifications and skills, would it make sense to try applying for jobs that offer healthcare coverage? 3, are there any medical procedures or preventative care, such as mammograms or colonoscopies, you might want to schedule now, this year, in case you lack adequate coverage next year. And the fourth point is, since Congress does still have the ability to extend the enhanced subsidies or make other changes, it might be worthwhile for you to contact your representatives. Finally, pay attention to the very real emotional and financial impact of this kind of change. You may feel fear, anger, and other emotions, much as you would with a job loss or other financial setback. The prospect of a large increase in your costs for health care is a real-world, real-time change that requires the same level of attention and preparation as any other major loss of income. Thanks for listening.